Good afternoon, everyone, and we want to thank you for joining us for the Flint Community Webinar on Coronavirus. It is, yes, week 88, November 19, 2021, and we're excited that you have joined us today for this webinar. This webinar is sponsored by the Healthy Flint Research Coordinating Center and our partners, the Flint Center for Health Equity Solutions, along with the Michigan Prevention Research Center. It is my privilege to serve again as your host for today, the co-director of the Community Core of the Healthy Flint Research Coordinating Center. And it is just a thrill that we're able to bring this information to you every week. As we've said to you on many occasions, our goal with the webinar initially was to bring a local context to a global pandemic. And as we have seen over the weeks now and months, there is so much information that we have to share about what's going on in our community that it does expand beyond just Corona, but we are excited that for these 88 weeks, we have had the partners join us every week to be a part of providing this credible and important information to you. Our partners span from the city of Flint, our state, the Genesee County Health Department, Greater Flint Health Coalition, Community Foundation of Greater Flint, Genesee Health Systems, Genesee Health Plan, and more. I won't name them all today, but we want to thank you for being a part of this session today. As we've mentioned to you, I want to just key in right here. Those of you that are social workers that are joining us, we want to encourage you, please stay on the entire time. Make sure you identify that you're here to get those social work credits and answer the survey at the end of the webinar so we do not miss giving you the information that you need to ensure that you get the credits. So a lot of work has gone into making sure that this is available to you, as well as the continuing education units for our community health workers. Today, we have, again, very, very important information for you. Our topics today relevant to some of the questions that you have asked us over the weeks, and we do appreciate your voices. So while I'm at this point, I don't want to forget, if you're listening to us now, we are live on Facebook. So if you're listening and you know friends, family, co-workers that want to get information about holiday preparation, pre and post Thanksgiving, children's vaccination updates, healthcare enrollment opportunities, and the update from the health department as well as the city of Flint, please share it right now and ask them to join us so that they can get this information firsthand. You may be getting the information from family and friends. Also let them know it will be available on YouTube. So today we have in our panel, we're going to share some really incredible information with you. I'm going to ask our panelists, because we've got so much to talk about, I'm going to ask Dr. Deborah for a holder. And we have a new panelist today, Joanne Herman from the Genesee County Health Department, who's responsible for the COVID work. Are going to ask Dr. Lawrence Reynolds. I see Dr. Hackert. Please join me in this roundtable discussion. There are so many questions. I want to start with something that was just asked the other day. I heard, and Dr. Hackert, I'm going to start with you. People have said we're in the fourth wave. And somebody said to me, what does that mean, being in the fourth wave of the corona pandemic?
So that's a great question. Epidemiologically, which is just the study of how disease spreads in the community or in a nation or in the world, depending on if it's a pandemic, we see it first start out and kind of peak, and then people take measures and it kind of falls off. But then another wave comes, because unless you eradicate it all at the very beginning, which was the goal, then you start to see it spread more. And then when you have this pandemic where it's all over the world and not being treated, because in 2020 we had no treatments for that, we would see the variants arising. And so then the first wave came, second wave came, and it means that you're going up in cases, coming down, and you think it's getting better, and then it can get worse because you're not eradicating the virus. it's pretty much agreed now that we're not going to eradicate this virus, but we do have a lot more tools in our toolkit now. We have vaccines, which is still the #1 way to prevent getting this disease, but we're also starting to have the other treatments available with the monoclonal antibodies are available, which will help when people do have mild or moderate symptoms. But we also we're anticipating even in December to get the pill form, which would be an antiviral that can treat the illness once you have it. Again, sort of like the monoclonal antibodies, we don't want anyone to get it. And that's how you prevent it with vaccines. But if you do get it, you can take the pills, and that also prevents hospitalizations and deaths in about half of the people. So who would otherwise be hospitalized. So those are the different aspects of it that we now have. So when we saw the third wave of going up, it went up very high. That was the Delta wave. And we really didn't have these things ready. We had some people vaccinated, but not all. So most of the country this early in the fall or late summer had what was experienced as called the fourth wave. And it's when you see the cases start to rise again, and then it peaks and then it starts to come down. Michigan, fortunately, at that time was not having this severe rates that we saw in the South and in the central plains of the country. And we are now actually, though, one of the highest in the country, if not the highest. I haven't checked today.
Thank you, Dr. Hackett. Now, you said something, and I want to talk to Dr. Deborah here for a minute. You said something about not going to get rid of it or eradicate it. And Dr. Deborah, you gave us a little lesson a few weeks ago about pandemic to endemic. And I want our listeners to understand, because she also talked about not getting rid of, more variants coming. And from the epi world, tell us what this means.
So Dr. Hackett sort of alluded to this early, when this virus first hit our population. The goal was to try to eradicate it, to stop it in its tracks from spreading. Now, remember, we were dealing with a global epidemic, a pandemic. It hit many places, and it hit many places hard. The problem is, and many people have wondered, how is it that this time last year, we had numbers that are very similar to the numbers that we have this time this year when we have the vaccine? And I would point people back to that Swiss cheese model, that multiple layered pandemic response model. No one layer is perfect, but when you start to put all of those layers together, you build this wall of protection. I think one of the mistakes that we made is we added in a layer, the vaccine, but we removed other layers. The point was to have all of those things operating at the same time to build up that wall. But before the vaccine was able to do what it was going to do, which was help with prevention, both of infection and prevent illness and hospitalization and death, we, were too quick to get rid of masking mandates and rules around, how many people could gather. And, we pulled back a lot of the supports that allowed people to work from home or collect unemployment and things like that. So people were forced back out into the workforce. And so before the vaccine could do what it was designed to do, we got these variants, and the Delta variant proved to be the real problematic variant that became the dominant strain. That is a little bit trickier than those earlier strains that were tested in the vaccine. So what's coming next, it will be our second generation of COVID vaccines, which will probably have a lot more effectiveness against the strains that are out. We hope that those second generation vaccines will also do a much better job of preventing people from contracting COVID. We hope we'll see fewer breakthrough cases. And in an ideal world, we see some of those other layers of protection also in place to support people, all happening at the same time. And in the absence of that, what we are looking at now is mitigation. We're trying to figure out how to lessen the impact as opposed to get rid of it. Now our goal is to figure out, how do we live with it?
So Dr. Deborah, you keep bringing us science language we have to learn. Now, mitigation.
Yeah, so a mitigation. So eradicate would be do away with it. Mitigation is how do we live with it and lessen its impact on our population.
Okay, so now, Dr. Hackett, I'm going to bounce back to you again, because you mentioned some medications that are coming up. You know, with the monoclonal, we talked about that a little bit, and we'll talk about it some more. And now you're talking about a pill. And then we've got the vaccine. So how are we to make sense of all this? Is there a process or a way we should think about actually utilizing these resources in these different ways?
Yes, you know, I know we have, it's been said over and over again, I've already said it twice, I think, but the vaccine is where you really want to focus the efforts. And that is what is most likely to prevent illness at all. However, it does have some, now with the Delta variant, it does have some, you know, increased breakthrough cases. Back in June and July, we were taking off the masks. We were saying, if you are fully vaccinated, you're not going to spread it to anyone, you're not going to get it. And you're certainly not going to be hospitalized or die from it. However, the Delta variant did change all of those things. I used to always like say subject to different variants arising. And that would still be the case now. We still have much of the world that's not vaccinated, and the variants are going to arise in those areas. And in our own area, we have quite a bit of people who aren't. So anyone can be the person who has that mutation. Mutations go on all the time in every single person. It's just they're not usually better than the virus in terms of the virus's goal of to infect others but not kill everyone off. You know, that's the goal of the virus, keep spreading. And so it's something that we want to prevent at all. But should someone get sick, we have a couple of different tools now to do what we know will help them stay out of the hospital. These are both things that are given to people who have mild to moderate symptoms. And when we think of moderate, most people think of, like moderate diet, moderate eating, moderate weight, which is kind of like what you want as your average, and is kind of a nice word. Moderate in terms of medical illness is actually anybody who can still basically breathe at home. So unless you're like completely dehydrated or you can't actually function, even if your oxygen falls a bit because you have, illness in your lungs and you're coughing, if you can still breathe and continue to like go to the bathroom, drink your water, eat your meals, as bad as you sound, as bad as it, as sick as you feel, that's still considered moderate illness. You would not be admitted to the hospital. So when you hear doctors saying mild to moderate illness, that can be quite severe illness. People do very poorly when they're at that level, just barely staying home. So it still works for both of those. So the monoclonal antibodies, which are antibodies that are formed in people who have had COVID and survived. The monoclonal just means one line of it. So they find that one line of antibodies that protected that person who was sick and got better, and then they clone it and over. So one line of antibodies that we know will go into your body, fight it off, but it doesn't help prevent illness in the future. It will work for about 90 days in someone. So after 90 days, we again urge those people who haven't been vaccinated to get vaccinated. And then the other form is an antiviral pill that's coming. And with that, I'm not sure if people are familiar with the pill that's like Tamiflu, which you could give when someone had the flu early on in the flu symptoms. And that usually really helped keep people out of the hospital or from severe illness. And that would be what is coming soon, hopefully in December or beginning of January.
Thank you, Dr. Hackett. And I'm mindful that we're getting some real science and medical lessons here, but I see nodding. But at both of there's been agreement that the vaccine is really one of our best lines of defense. And there's still quite controversy about that. So we now know that we have the children's emergency use authorization through Pfizer. I want to invite Joanne Herman to talk a little bit about what's happening, because we just got that authorization November or 5th, I believe, early November, and already there's a lot of work happening, and I think I just lost her. Uh, she's out at an event right now, so I'm gonna have to switch gears here because I see we've lost connection with her. But Joanne Herman works with the health department as a COVID coordinator, and she's working right now at a clinic. So I think they had a little bit of a glitch there. So I'm gonna switch gears. We're going to come back to her as that first line of defense, talking about children's vaccines. But I want to go now to Dr. Reynolds and to Dr. Deborah. We want to talk about pre and post holiday preparation. Dr. Reynolds, you just chuckling. So I want you to get us started. You said it before, and I know you'll say it again. So just open up the microphone and tell us pre-holiday preparation. Yes, sir.
If you're smoking, work on quitting smoking. Give yourself a gift for the holidays. If you have a substance use problem, find treatment. Find somebody to help you with that. And then, as Dr. Deb says, you have to have a plan. Remember back in the election days, she'd say, you have to have a plan before you go to the polls. Well, you have to have a plan before you bring people in the house. And even in my house, this is a touchy conversation because we have to be real clear on what we're trying to accomplish. So number one, get vaccinated. Number two, if you have someone in your household who's immunocompromised, in other words, their immune system is not operating at full speed because of a disease, a condition, or an organ transplant, you really ought to consider limiting the number of people who will come to your house. And if you invite that limited number, they should be vaccinated and they should be masked, and maybe you ought to keep that visit short. Okay. Number two, or number three, if there's someone who comes and you don't know their vaccination status, you want to see their test result. And a test from yesterday or 2 days ago is not 100% accurate for 2 days later. However, if they're symptomatic, they should stay home. Cough, sniffles, fever, stay home. Okay. If the test is negative, you don't have an immunocompromised person in your house, you may suggest, okay, you can come in, you can wear a mask, make sure your house is well ventilated, and maybe limit that visit, and then how you serve the food. It should not be buffet style because you don't want everybody dipping in the dishes. So one person who's vaccinated, who's masked, who wash their hands, unfortunately serve everybody because you really want to limit the number of people who have contact with the food. Now, say you show up at a place, even if you're vaccinated, even if you're masked, if you have symptoms after that gathering, go get tested. That at least will give you an idea that you got in and got out without being infected. And people will say over and over again, look, I got the shot. Why are you talking to me about infection? Because we can carry the virus in our nose and the antibodies don't get to our nose as well. And that's why we talk about wearing the mask. Hopefully one day in the future, we'll have a spray or something for the nose, like we have for flu, that may reduce that possibility. But until then, we have to protect ourselves and everybody. So after the event, get tested. You've heard me say before, after you fly somewhere and you return home, get tested. You've heard me talk about my 93-year-old mother. I don't go visit her until after 2 or 3 days after I get home and I get a quick antigen test. Then I'll go visit her, but I'll wear a mask. And this is just life in the COVID pandemic. We're not in the middle. We're not at the end. It ain't over. And we will have to learn how to live with it.
Thank you, Dr. Reynolds. Dr. Deb, hold on to that thought because I know you got one. I need to run over here to talk to Joanne Herman because she's at a clinic and she needs to get back out to the clinic. But one of those layers of protection is the vaccine. And we were challenged before because we didn't have them available for our children. And so now we do. So Joanne, tell us what's happening in the world out there with respect to getting children vaccinated.
Great. Thank you, Yvonne. Real time, I'm at Lake Fenton High School, and I'm in a glass room out overlooking lines and people and parents. I wish all of you could see what I'm seeing right now because it would make all of you smile. This is our second week. We're finishing our second week of vaccinating children ages 5 through 11. And at each of our sites, we've had a number of pop-up sites. We continue to offer first, second, third doses and booster doses. So I wish you could see also the examples of parents coming in, getting their booster dose and doing that first, and then putting their child on their lap and their 5 to 11-year-old getting their first vaccine. It's really heartwarming. I've also seen great examples of parents that were reluctant before, trying to set that good example for their children, them coming and getting their first dose, which makes my heart really warm, and setting that example, getting their first dose and bringing their child in as well. We've been all over Genesee County, and we're going to continue over the next several weeks. So today we're in Lake Fenton. We were at Southwestern Academy in Flint earlier. We've been at Davison, we've been at Grand Blanc, and we're Mount Morris. We've been all over the county. In addition, at our 3 core churches, we continue to offer the pediatric Pfizer vaccine along with our other vaccines that we provide on a regular basis. So good lines today. They had a half a day of school today. We took advantage of that. And so we're excited. We'll be here through 5 o'clock tonight. So even if parents are working, they can pick up their children and bring them in to get their vaccine and get their booster doses as well. It's a good day.
Just while you're there, just to really re-emphasize, the children are getting a lesser dose than the adults get.
So our pediatric population, and I'm talking about our children of the ages of 5 through 11, have both a different dose and a different strength. So it's a total different vial of vaccine than what they get if they're 12 and above. Correct, Yvonne.
So I know that there was a question for some of our parents. You know, they're concerned about the amount of vaccine children are getting. So thank you for answering that.
Yeah, it's a very small amount. It's a very tiny little syringe, and it's appropriate to the age of those little arms. And I've got a number of pediatric nurses, immunization nurses that are very experienced. I've got a handful of physicians that are here today. We all wear this orange badge to indicate that we're comfortable, and at every table we also are able to give their the adult counterpart with them the vaccine as well.
So
We have, go ahead.
So there are precautions being taken to ensure that the right doses are going to the right people, the right vaccines are going to the
100%.
right.
Safety is number one. We have a color coding system that is second to none. So our pediatric vial for the Pfizer vaccine has a little orange cap. And so all of our paperwork, our bags that we bring the vaccine in, the people that are working, it's an orange crew that are there for the pediatric population. We have multiple check-in points where we check. We ask that child, how old are you today? We double check, we have the paperwork, and we go into the state database system and confirm that they're also of the proper age to get their vaccine. So yes, we're very careful, and we're very assured that we're giving the right dose for that right age group. Also, as our parents are coming in, and others in the community, as they're getting their booster dose, they're able to select. So we have J&J, we have Moderna, and we have Pfizer at almost all of our locations.
Now, Joanne, we're taking a little extra time here, but this is really important because parents have expressed some concerns, and I thank you for sharing that. One question in our queue, though, is what about children are a little bit heavier? Does it matter that they may be heavier than normal, if you will, if that's such a thing?
Yeah, we do not go by weight-based dosing. So the weight, it is strictly by the age. And so we had a child that came in to Southwestern this week that was 11 and almost 12. He was probably a week away from his 12th birthday. So he got the pediatric Pfizer dose. when he comes back in 3 weeks for his next dose, he will get the adult dose. So it is not a weight-based, as some of our pediatricians and physicians in the room would know, but this is strictly by age. But it is based on the age that child presents for their vaccine on that day.
Thank you, Joanne. I know you've got to go and get back in clinic. We appreciate you for taking this time out and being with us this afternoon.
I just want to add a couple things. So fear is a big issue, maybe with children, and we have a very talented team that are there to help ease their anxiety. We've had kids bop music playing in the background. We've had bubble machines. We have stickers. We have colorful Band-Aids. We have a lot of things to help make that child experience a lot better. And one of our MSU medical students, I'm proud to say, helped make a vaccine video for all of our care providers that are vaccinating, where we really talk about the right language and the right approach for children. And it's been very successful, so that we're all on the same page and really make their experience the best it can be.
Thank you, Joanne. Appreciate it so much. And I know there's more to come. We'll invite you back. You always have an open door to come back and share with us in the future. So thank you so much, and the best to you today in that clinic. We know that there are a lot of questions, and still we are in the business of educating and making sure you have the appropriate information as best as we know it, so you can make an informed decision. So please consider that. Early on, they said children weren't getting the virus. But we are now seeing more children in our hospitals unvaccinated who are seriously ill. And so we're just asking you to consider that you're taking care of yourself and your children. So I want to run over here to Dr. Deborah as we round out this segment for some closing thoughts about holiday preparation. Dr. Reynolds talked a little bit about and before we get back for our webinar on the next Friday, Thanksgiving will have happened. So give us some thoughts about post-Thanksgiving real quick.
I just want to share this real fast. Can you see it?
Yes.
These are our 4 Ps that we put together. I've been listening to my colleagues. I have my own thoughts. I've combed through the CDC. I talked to my good friend, Dr. Shanina Knighton, who is a infection preventionist, and I whittled it down to what I call the 4 Ps. I like the Ps. Dr. Reynolds said I like to plan. During the voting season, I told people, plan your vote, vote your plan. Now I'm telling people to plan your holiday and then work that plan at your holiday gathering. So prepare your guests. Dr. Reynolds talked about what that might look like. Ask people to get vaccinated. There's nothing wrong with asking. Just say, look, if you're not vaccinated, would you get vaccinated? You can be doing that both for Thanksgiving, some of the other holidays that come up around Christmas. Not everybody celebrates Christmas, but other holidays are happening around that same time of year. So prepare your guests. Know who's coming. Keep it small. No uninvited guests. Let people know. Are they allowed to bring somebody with them? If they're not, you should let them know. So prepare your guests in advance. Prepare your space. Make sure that your space is clean. Make sure that you have things to keep the space clean around. Keep wipes and paper towels in the bathroom. This is not the time to have people, drying their hands off on that one pretty towel with the flowers on in the bathroom. So keep your paper towels and your cleansing wipes in the bathroom, and ask your guests to wipe down behind themselves. And then make sure that you space people out as much as you can at these events. And then practice good prevention while you're at the gathering. Have the guests sanitize their hands upon entry into your house, whether it be they go to the bathroom and wash their hands, you've got some wipes available at the door, etc. Like Dr. Reynolds said, have one person serve the food, no buffet style. You can pass this thing through the utensils. You get it on your hand. It can be on the utensils. You touch your face as you're eating. Lo and behold, you've given yourself COVID from a serving dish. And if you can, open up those windows, get fresh air circulating, and then remember that outdoor space is the best. If there's a way to activate your outdoor spaces, consider doing that. And then be proactive about the follow-up. When people are gone, clean your space down. Don't forget the doorknobs, the handles, the light switches, the things that everybody touches. Encourage people to get tested after the event. And then ask all of your guests if they have any symptoms post-event to let you know. And then you be a good steward and you let the other guests know if they come back and report a positive test. So that's what we're asking people to do. Basic stuff, the 4 Ps, prepare your guests, prepare your space, practice prevention at your gathering, and be proactive about your follow-up. And if anybody wants to have access to this, this was featured in last week's health equity brief. We just didn't have time to get to it during the webinar, but you can go onto fches.org, FCHES, Flint Center for Health Equity Solutions.org. Under resources, you'll see the briefs, and this was last week's brief, and it is there for people to think about. And this applies both for Thanksgiving and for all of your gatherings.
Thank you, Dr. Deborah. And I just, Dr. Reynolds, you got one more very important point to make, and I think we need to make it because holidays coming and we want people to be prepared.
Oh, yes. COVID is not the only thing out there. Many of us have pre-existing conditions. We're under the care of a provider. We're on medication. Do you have enough medication to make it through the holidays? Because you don't want to be trying to call somebody on Christmas Day or Thanksgiving or during a high holy day to ask for a refill. So take care of that now. Make sure your medications are up to date. If your doctor says, well, I haven't seen you in 9 months and you were supposed to come back 3 months after that, you probably need to go in and check in with your doctor before the holidays, because the goal is not to have a condition go out of control and you have to go to an emergency room or much less an urgent care center. Now, if you need to go to an urgent care center, know which one your doctor recommends. If you need to go to an emergency room, know which one your doctor recommends. Just don't, well, under these conditions, you may have to go just anywhere that's open, because it's possible an emergency room may be closed and you have to go somewhere else. And that returns us to our main theme again. You have to have a plan. You have to have prevention. Vaccination is the foundation of prevention, and you're looking out for yourself, even if you don't care about anybody else.
Thank you, Dr. Reynolds. And stay tuned because there's more coming in the weeks upcoming. Because we're talking about prevention, we want and preparing for the holidays. We're going to ask Sherelle Brown from the Health Department to please come and share with us because there are some adjustments for the holiday week. So Sherelle, give us the update from the Health Department, please.
Good morning. I like what Dr. Reynolds said. Vaccination is the foundation for prevention. That is so true. In Genesee County, we have administered just under 370,000 doses of vaccine, and we want to continue to see those numbers rise. In the past week, we've seen 110% increase in COVID cases, and more to come. So cases are high and we need our vaccination rates to be high as well. We're seeing an increase in COVID-19 inpatients in all of our hospitals. And this is not just in Genesee County, but it's actually nationally. So we have to do something about it. Next slide, please. And so we have gotten that approval for the Pfizer vaccine for emergency use in ages 5 through 11, as Joanne just let everyone know. And with that being said, that's one of the reasons we continue to see our vaccination rates to increase in Genesee County. And we just need our friends and families and parents to be on board. Next slide. So there's a lot going on. We're still at high transmission with our cases, and that's why we keep pushing every week that members of the community come out and get their vaccination, because as Dr. Reynolds said, it is the foundation of prevention. And we want our kids to be safe, especially Dr. Hacker just announced that the removal of the mask mandate, which will be effective on December 22nd of this year. So it's important that we get our children vaccinated. Any classrooms that have children 5 and above will be exempt to this mandate, but we still strongly encourage the school settings to enforce masks. Next slide. So we do have a couple of upcoming clinics. Next week is Thanksgiving, so we will be observing that holiday as well as the Friday after that. So we have limited clinics for next week, but we still want to offer the vaccine to everyone in the community. And as mentioned earlier today, we are at Lake Fenton High School. We'll be there to 5 p.m. administering Moderna and Pfizer for ages 5 through. Next Tuesday, we'll be at Our Lady of Guadalupe, which we're there every Tuesday from 12 to 2 p.m. We'll be administering Moderna and Pfizer as well. And then on Wednesday, the day before Thanksgiving, you can catch us at Central Church of the Nazarene from 10 to 12 p.m., where we'll be administering Pfizer, Johnson & Johnson, and Moderna. As I mentioned before, we won't be in service for Thanksgiving or that Friday after, but we will resume our vaccination clinics the following Tuesday. And it was mentioned before, after gathering, it's important that we get tested, especially if we have not taken precautions necessary to decrease the spread. So on the screen, I have some listings in the community where you can go to receive a free COVID-19 test. We have Word of Life Church, Bethel United Methodist Church, as well as Macedonia Baptist Church. And these three churches also offer the Pfizer vaccine as well. And you can visit your local Walgreens or Rite Aid for a test. And then Hamilton Community Health Network is also available to the community for testing. And again, to our homebound citizens, we ask that you reach out to the health department so that we can service you and make sure that you are protected with a vaccine. So give us a call at 810-344-4800, or you can visit us online at www.gchd.us/vaccine scheduler/. Stay safe during the holidays, please.
Thank you so much, Sherelle. And just as a reminder, please make sure you take note of the sites that are available so you can ensure that you get your testing and you get your vaccines if necessary, if you haven't already received them. So Dr. Verholden, you mentioned to us earlier the equity brief, and this has been something really, really important from the Flint Center for Health Equity Solutions. So can you give us an update to start that conversation from the equity brief?
Yeah, sure. Y'all heard earlier, Dr. Hackett, I think, did a great job of talking about what these waves look like. I do some national work every day. I'm on the radio and I've watched Michigan not follow the national trends as rates were going down. Flint and Genesee County have been no exception. We've had an increase in confirmed cases. Again, I always point to people, we are trying to make this not overly complicated for people, but to be as telling as possible. So we report out on the confirmed cases every week and we break them down by race. So the top of that red line is what is known by the end of the week. So if you compare the top of the red line from last week to the top of the red line this week, you can see it went up in Genesee County. Those numbers increased from 816 cases to 924. And in Flint, the numbers increased from 179 known confirmed cases to 274. What's going to happen is, in the next week or two, additional cases will come in for this week. They've already been tested. Those people know they have COVID. They've been in isolation. They're taking care of themselves, but their test result has not made it into the database yet. So those numbers are going to be even higher. We know we call those lag cases. They're cases that come in a week or two after the closeout for that week. It's important with COVID that you count the cases when they were actually a case, not when the data come in or when the data hit the database. So if the confirmed cases are higher than they were last week, we know once those additional cases come in, it will be even higher. And then that testing positivity rate, which tells us of the people getting tested, what percentage of them are positive, that's also going up. That went up from 19 to 22%. So that means, again, about 1 in 5 people who are getting tested for COVID, their test is actually positive. The caution that I want to give to people is it's important that people continue to get tested. And I encourage people, don't only get tested if you have symptoms. By the time most people have symptoms, you have a high viral load. You've likely infected others, especially in your household and in your workplace and people you come in regular contact with. So the key with the testing is to get tested as a function of your exposure. If you've had recent travel, you get tested. If you're going to work every day, I tell people you should be getting tested. If you've been at a large event, get tested. If you had a known exposure, get tested. And obviously, if you have symptoms, get tested. But those other pieces are important. I myself have been to some of our community testing sites. It's like the best people, positive attitude. They want nothing but to serve. If I could just throw it out there, Yvonne took me to get a COVID test, and it was cool because I was able to get a rapid test, and Yvonne got a rapid test and the PCR test. You said, I want to be doubly sure. We have those resources. We are not in a state of scarcity. What they don't want to do is test people in the hospital who don't have symptoms or test people in the care facilities. They're really reserving those facilities for people who are sick. So go to one of the community testing sites. Sherelle presents them to us every week. Get tested. Get tested. If you go to a large Thanksgiving gathering, after that event, get tested. And guess what? At the testing sites now, many of them, you don't even need an appointment. You can just show up and you can get your test. Before we made it home, I got a text message with my test results, and they were negative, which was great. But more than anything, it was just great to know. And it was nice to know how easy it is. And then bless their hearts, on the way out the door, they gave me a whole baggie of fresh masks that I could use. So that high testing rate says to me that we've got a lot of people who are just waiting until they have symptoms to go get tested. So encourage people to just get tested regularly as a function of your exposure. Next slide. We've got some clear recommendations for folks, and I see some questions in the queue around how can we, convince parents to get their children vaccinated. And so we just put some things together, and I want to acknowledge Mary Catherine is not here. She's in a seminar today, so I'll be presenting all of the brief, and our wonderful illustrator, Blair Warren, who tries to put really beautiful images with some of the recommendations that we give. But the COVID vaccines for children, they are safe, they are effective. Some of the questions that I've heard people ask around, well, should it be based on their weight and not their age? Or I just want people to understand the clinical trials testing that these vaccines go through specifically for the younger populations. They don't just take what happened with the adults and then just try it on children. Those different stages of clinical trials are to get all of those questions answered. And one of the first questions that they have to answer is, what is the right dose? And what is the right protocol for determining the dose? Is it age? Is it height? Is it weight? So that work has been done. And if people don't know, our process of clinical trials testing in the US is the most rigorous of any that I know of. And that is not to say that other countries don't have good processes in place. I can just say with confidence, the processes that we use are good. They're very robust, and they're strong, sound practices with many checks and balances along the way. So it's important that people know the COVID vaccines for children are safe. If children are exposed to COVID in the clinical trials, it was still 91% effective at preventing children ages 5 to 11 years. That's important to note, because the clinical trials that started happening with children happen later than they happen with adults. Some of the numbers that we saw with adults, we didn't have very many variants out at the time. By the time they started the clinical trials testing with children, we had started to see variants emerge. So this is a really great thing, because it looks like it's very strong at preventing kids from getting COVID in the first place, and definitely from preventing them from getting sick. Getting the children vaccinated helps protect everyone. Children are much more likely to walk around with no symptoms or very few symptoms, but that doesn't mean that they're not an active case, and it doesn't mean that they can't shed virus and infect others. And what we're actually seeing is that our sweet babies are oftentimes the one, especially since they've gone back to school, who will be the vector, right? They'll be that connection point between an exposure that happened over here and be the one that kind of brings that into the house. And even though they may perform better and their bodies may do a better job at fighting off COVID, many of the adults that those children will later expose or get sick are at much greater risk for having problems. So getting the kids vaccinated protects everyone. And then the kids who are fully vaccinated don't have to quarantine if they come in close contact with someone who's been diagnosed with COVID. The CDC guidelines say if you are fully vaccinated and you have a known exposure, you get tested 5 to 7 days after that known exposure. I personally have been advising people to go get tested 4 days. I think 4 is a good number. 4 days afterwards, most people, and if you look at the metrics of tests, there's 2 metrics, the sensitivity and the specificity, how well a test will identify a true case, a true positive, and how well it'll correctly call you a negative. Those tests tend to perform the best at around day 4 or day 5. The reason I personally say do it at day 4 or day 5 is because if you wait till day 7, you've had more days potentially of being a case, not having very many symptoms, and potentially exposing people. So I encourage people go get tested at day 4 and then maybe go back if you're negative around day 7, even if you don't have symptoms. And then you just wear your mask indoors for those 14 days. And the last reason is because some schools may actually require the vaccinations for kids to participate in activities or even to attend school. That is likely on the horizon. So parents who are doing that and getting their kids vaccinated are getting ahead of that and ensuring that their kids can participate fully in everything that's available in the school. Next slide. We got 2 recommendations this week for policymakers. The first is we want to reinforce hospital capacity with unused funds. We know they've called this period the Great Resignation. A lot of people have left their jobs during this season for various reasons, whether it be, vaccine mandates or just being overwhelmed. I know our healthcare workforce has been especially overwhelmed. I had a conversation with a group of early stage physicians, many of whom are 1st and 2nd year residents. They've spent all of their residency battling COVID, not really focused per se on the things that they thought they were going to focus on, but really spent most of their residency battling COVID and treating COVID patients. And we've just had a lot of loss in the healthcare sector. And so what we're encouraging is use some of these unused funds. There's billions of dollars on the table, and we're trying to figure out how that money needs to be used. And some of it needs to be used, we think, to shore up our healthcare workforce with better pay, better benefits, and better supports for them, because the job that they're doing, especially during this season, is invaluable. And then lastly, to ensure access to clean drinking water. Water insecurity is an abomination in a country like America. And the fact that we still deal with it in so many parts of our nation, it's just hard to wrap our head around. We've all heard about what's happening in Benton Harbor. They're facing a similar water crisis. There's no safe level of lead for humans to consume. I want to remind people of that. We learned that in Flint during the Flint water crisis. There is no safe level of lead, absolutely no safe level of lead for children. Lead is a potent neurotoxin, and water security is more than just lead. You can't get away from water. You need it to survive. And drinking water, especially, you can't get away from it. So Benton Harbor right now is on bottled water, and we all know in Flint what that feels like. And we also know what it feels like when supposedly the water is safe again, and you still are reluctant, and you have that doubt and debate when you brush your teeth in the morning. Should I run out of bottled water in the bathroom? Should I go downstairs and go get me a new bottle? Or you just say, forget about it, and you just go ahead and brush your teeth with the tap water. We all know the stress and trauma that causes. So we're really asking our legislature to put up the money to start to deal with our infrastructure problems. This federal Build Back Better program is really, and President Biden is saying he wants to really support infrastructure, and water infrastructure is just so important. A lot of people don't know this. By mandate, many municipalities have lead pipes that are the pipes that deliver water to people. And that's because at the time when water infrastructures were being developed for cities, lead-based pipes were the best thing that we have. Really, many of the options back then were lead or wood, if you can imagine that. So it's time to start making those investments. And what I always tell people is they look at the price tag and they say, it's too much, we can't do it. And here's what I tell people. The places that have done it have made long range plans that predate, that outlive politicians, right? In most cities, there's some term limit on how long you can be a mayor. But some mayors have said, I am signing into law right now a 20-year plan. We're going to replace 5% of our water infrastructure every year for the next 20 years. And guess what? If you do 5% every year for 20 years, it's affordable. And in 20 years, it's done. And in the places where they've completely replaced their water infrastructure, that's how they did it. But you had to have leaders who were standing for the people, not for their own reelection or for their own personal gain. So we want our legislature to make those kinds of investments because we think and we know access to safe drinking water is a human right and not a privilege.
Well, Dr. Deborah, what a lesson.
Yeah.
And a good segue, thank you, because the voices do make a difference. And when we raise our voices, change can happen. And that's what happened here in Flint, Genesee County. And the result is a Genesee health plan. And many people have asked about affordable care. We are now in the midst of open enrollment. So Jim Melanowski from the Genesee Health Plan, as the CEO, is going to give us an update about what's available for healthcare coverage in this community.
Yes, open enrollment is now happening. So holiday season, I don't know why they have this enrollment during this time, but just remember it's open, and it's open a little bit longer this year through January 15th. And there are some very affordable options. In the past, the Affordable Care Act was known as not being affordable, but people are really seeing some results because of the American Rescue Plan. So if you signed up for healthcare and you couldn't afford it like a few years ago, come back to us and we can see if there's something that's better for you, because there's a lot of change that's occurred over the last year or so. So give us a call, 844-232-7740, and we can walk you through that. Next slide, please. So again, if you know of any Afghan refugees that are coming in, there's some possibilities for enrollment in them, some special enrollment. So again, they can get enrolled into Medicaid or healthcare.gov. So give us a call at the health plan. And I don't think we've ever done an enrollment with this group, but we can try to figure it out. Next slide, please. You know, who are the uninsured? Remember, when you're having these conversations with your friends and relatives during the holiday season, if they say, well, I don't have insurance, or I work at a daycare or a dog groomers, and I work for myself and I can't afford to buy health care, that's the type of person that needs to contact us at the health plan, and we can get them on the health plan or see what other types of coverage that they qualify for. There's a whole group of people out there that are thinking, I don't qualify for anything, or there's got to be something that, you know, and so please give us a call or give our friends and colleagues at the Greater Flint Health Coalition or Hamilton. All of us can help you find that health care that everyone needs at this moment. So again, there's a lot of key takeaways. Again, with the new laws that are here, there's a lot more affordable options. So, and Dr. Reynolds talked about this before, doctor's visits, medications, preventative services. It doesn't do us any good to get a vaccine if we can't continue to see the doctor and do these preventative services and stay healthy. So again, it's such a key to have healthcare and healthcare coverage. And you can skip on to the next slide. And again, there's tax credits available. So if you apply on the Affordable Care Act, you could get some additional money savings back to you. That's what this new American Rescue Plan has allowed. And people are coming in to us and are receiving these tax credits or reduced premiums. And it actually is really working. And so it's been really fun and good to see. And people are really excited about that. Next slide, please. We can do it over the phone. We can do it virtually. And we can also help people in Saginaw and Bay County. So if you know anybody in those areas and they don't have any healthcare coverage, have them contact us, and we can help those folks in those communities as well. And I just mentioned Hamilton and Greater Flint Health Coalition. We can skip over that slide, Yvonne. And yeah, there's our phone number, there's our website, there's our Facebook page. Those are great ways to get a hold of us and learn more about this. And I could talk for hours, but I'm going to stop right there.
Oh, thanks, Jim. We appreciate it because we do get a lot of questions even now. People wondering about where can we go to get healthcare coverage. And I think Gary Jones talked about the catch-all website, but the catch-all phone number for healthcare coverage is 844-232-7740. Thank you so much, Jim. Appreciate you. We want to just move quickly to get updates from the city of Flint. Kiana Towns, who's the manager of public health.
Good afternoon, everybody. I will be brief. I'll start with the research symposium. Is fantastic this morning. Yvonne, hooray to everybody on the team. Thank you for that. Just a couple of updates from the city of Flint, beginning with a reminder about trash for the holiday next week. Thanksgiving is observed on Thursday, November 25th. So our priority trash will delay trash pickup by one day. So if usually your trash gets picked up on a Thursday, priority waste will pick up your trash on Friday. If it usually gets picked up on Friday, they'll be there on Saturday to pick it up. If you have any concerns or any questions, you can contact priority waste at 855-WASTE-65. That's 855-927-8365. And there are a couple of job postings open here at the city of Flint. They include two positions for the the Choice Neighborhood Initiative. And those positions are for planners for a CNI project 1 and 2. For information on those job postings, you can visit us at cityofflint.com and then click right there on the jobs tab. There are several positions open, but we're just highlighting those two this week. And then Small Business Saturday is coming up this Saturday, November 27th, next Saturday, excuse me. And so we want to highlight local businesses during that time, encourage residents to come out and support businesses like Flint Handmade and other small businesses. So if you could please visit us at our website, visit us on our social media pages. There'll be more information on that event on November 27th. And that's all I have this week.
Thank you so much, Kiana. Glad to get that update for trash because we're going to probably have a lot of it after Thanksgiving. Just want to take a moment to highlight a couple of our additional partners that we are every week now going to say a special thank you to partners who participated and helped us so much. The Greater Flint Health Coalition, Community Foundation of Greater Flint, and Genesee Health Systems. Without these organizations being available to answer questions for you, we would not have been as effective as we have been. So we want to give a shout out to these organizations and ask them to continue to be around so you can get those questions answered about the upcoming programs. For those of you, and thank you, Kiana, for that shout out about the symposium. For those of you that were at the symposium a little bit earlier, we want you to just come back at 1 o'clock immediately following the webinar, because we're just a couple minutes away now, to go back to the symposium website or webinar. There will be a highlight on a project that is being done right here in our community and other places, the SeroNet project. It's a research project that we want you to know more about. So please join us at 1 o'clock for our bi-monthly research seminar that gives real specifics about research projects that are happening here in Flint, Genesee County. So thank you so much for joining us this morning, and please join us this afternoon. We want to encourage you and thank you. I saw someone put their information in, community health workers and social workers. Please be sure to respond to the survey that will immediately follow this webinar. You may have to wait a couple of minutes or at least a minute for that to pop up, but please complete that that questionnaire so we can be sure that you get your social work credits and your CEUs. Let me say again, on behalf of the Healthy Flint Research Coordinating Center, we thank you for joining us. Please like us on Facebook, subscribe to our YouTube channel, Healthy Flint, and as always, you can email us at info@hfrcc or give us a call at 810-835-2130. Again, that number is 810-835-2130. We appreciate you joining us every week. Thank you so much for the incredible questions that you put in today. We'll look forward to continuing to respond. We will have a webinar next Friday after Thanksgiving. So if you can join us, please do so. If not, we'll be on YouTube or Facebook. Join us for the Healthy Flint Research Coordinating Center webinar. It'll be 89. Thank you for joining us today, and we'll look forward to talking with you next week.